So I'm going to present Natalia now. So psychologists know for quite some time actually that if you ask somebody about their experience in the experience they have in a certain event, or in this case in our school, the answer that people will give, that will depend only on two things. First, the moment they judge that, like, the best part of the event, and then how much they liked the last part of the event. So it's always a good idea whenever you're organizing a school or any event to end your event with a highlight, with a talk that everybody will like. And this is something that we're going to do precisely with Natalia. So Natalia will give the last talk in our school. So I'm going to present her. Natalia is a computational psychiatrist, also a neuroscientist. She has experience in multiple aspects of computational neuroscience and psychiatry research, and also practice. She has a PhD and master's in neuroscience, and also bachelor's in medicine, with residence and clinical practice in psychiatry at the Federal University of Rio Grande do Norte. She has published scientific papers pertaining to cognition and analysis of brain function in many directions. For example, she was a pioneer in the field of computational psychiatry, applying graph theory to narrative analysis for the clinical evaluation of psychosis. She's also interested in how these narrative markers typically develop in children's speech. She conducts studies of computational language analysis to understand dream reports and their neural mechanisms. She's part of different communities and symposiums, such as the Schizophrenia International Research Society, and she was appointed by Forbes magazine as one of the 20 most powerful women in Brazil in 2020, and she was also the first Brazilian scientist ever to be shortlisted by the prestigious journal Nature as an inspiring scientist in 2019. And she's the winner and nominee of many awards, such as the DASA Prize for Medical Innovation and Innovation for Medical Diagnosis, and the 2017 SUS Brazil's Ministry of Health Prize, Science, Technology, and Innovation recently. So Natalia is really one of the driving forces behind the use of speech and natural language processing to understand the human mind, and also to understand different psychiatric problems that such as schizophrenia and many others that she will tell you about. So we are really, really happy to have Natalia with us to conclude our school. So Natalia, thank you for being here, and whenever you like to.
Thank you for the invitation. It's really a pleasure to be here, and I'm very excited to share with you this almost 1 decade of research in this field. So I will now share my screen. Okay. Can you see my presentation?
Yes. Yes.
Oh, great. So I will today share with you some aspects of natural language processing tools that we use it here, some that we've developed, some that we just applied for questions about mental organization and how this could inform about cognition and pathological and physiological development. So I will start with a question. What is an organized mind? This is a hard concept to define, but actually we have the sense that an organized mind is able to share those inner states, thoughts, feelings as a chain of events, a chain of thoughts. And by doing that, we can see that people that actually with a disorder like schizophrenia has somehow fragmented way to express themselves and to share those inner states. Like here is Tamira. She had her life well documented in this awarded movie, Tamira, and she suffered from schizophrenia. She lost her social bounds very early in her life, and she was actually unable to express her feelings in a way that could be understood. So I will take a brief moment here, just 30 seconds of her report about her internal states, just to give us a flavor of this kind of symptoms. she tells us conscious, lucid, and aware. And I have feeling, fine. What gets caught, welcome it, recorded is the feeling. Now, for example, sentimentally, visibly, and invisibly transparent format, as I told you already, I'm in a place far away, in a space far away. Looks like poetry. It has a lot of meaning, but actually, the roots that she addressed to report this, it's actually very disturbing and it's very fragmented. So this, there are a set of symptoms that we know as formal thought disorders that actually it's described since the first descriptions of schizophrenia. It has the sense that a disorganized mind are not able to express through a word, a sequence of words that is actually expected by the listeners. So psychiatrists, psychologists have described this and are trained for years to describe this with words. But how can we measure this precisely? So nowadays we see the development of natural language processing tools that are actually developed to make it easier, this understanding between machine language and human language. And we are now applying this to better understand the set of behaviors related to communication. So I will talk to you about this structural analysis that we've developed here in Brazil based on graph theory. And somehow also we could use in meaning and the semantic content using strategies related to semantic similarity. So talking about structure, you can ask for an individual, for example, to report a dream, and he can answer you like, I was dreaming of a show. But also in the same way, the same sequence of words can be designed as a trajectory or a graph, in the sense that each different word will be represented as a node, and the link will represent the sequence of words. So an individual that's actually reporting memory like a dream can design a trajectory, and as a graph, we can calculate several attributes, such as like the amount of nodes, the amount of edges, the amount of repeated edges that it's actually linking the same pair of nodes, or the amount of nodes that are in the same set of the largest connected component, for example. So you can count the nodes that are actually in the subgraph, in which all the pairs of nodes are mutually reachable. The node A reads node B, and also the node B reads node A for a certain path, okay? So by doing that, we first describe this using actually handmade graphs, and using another software to say to the computer what was a node, what was an edges, and analyzing a very small data set, we could see that even on this small data set, we were able to distinguish based only on graph attributes, schizophrenia from control group with an area under the ROC curve of 0.9. If we reach out the level of 1, it would be perfect. It means that it had a higher sensibility and also specificity to distinguish between those groups. And area under the ROC curve of 0.88 to distinguish between schizophrenia and mania group. So the next step was to automatize this process to transform a text into a graph. In that, we developed the software that's available, it's free on our website. please email me if you are interested on this. And we could, by doing that, by automatizing this process, we could analyze 60 subjects, 20 subjects per group. And we ask them to report as a dream. And as this representative example shows you, a schizophrenia group tended to report a dream performing graphs that were with much smaller LSC or much less connected than compared to bipolar group or to the control group. So by giving this connectedness attributes as inputs to a machine learning algorithm, we could actually distinguish schizophrenia from control group with an area under the ROC curve of 0.94 and schizophrenia from bipolar group with an area under the ROC curve of 0.77. Actually, this distinction here, it's pretty challenging in the clinical practice. What makes us very excited to understand what were the psychological and the psychopathological things related to correlations, associations related to that. So here we studied, this is a correlation matrix where the color, it's coding the effect size from the correlations, the Spearman's correlation. And here in each line, you have a graph attribute, and in each column, you have a symptom that was measured by the psychiatrist. So here is the application of the PANSS. It's a scale that measures the severity of symptoms. And here is the PPRS, that's a similar scale. And as you can see here, we had some significant correlations between negative symptoms measured by this negative subscale and connectedness attributes such as LCC, LSC, and the amount of edges, meaning that those patients that had more severity in the blunted effect and showed poor eye contact with the interviewer, or had difficulty to understand abstractive thinking like metaphors, or lack of spontaneity on talking, were those ones that produces the less connected graphs. So this is interesting and important to be applied in a chronic patients, but it's even more important to be applied in the first symptoms that a subject feels. So here we apply the same technique. We ask the patients to report as a dream, and also to look at some affective images and to report a story based on those pictures. But they were feeling those psychotic symptoms for the first time and seeking for help for the first time. So this first episode of psychosis, it's actually a very important moment of breakdown for those patients. It's actually the moment that a teenager or a young adult lose several social bounds, and that for that it's important to predict this development of this disease. So here we collected 21 subjects experience the first episode of psychosis, and we follow up them to 6 months to establish the diagnosis. And after that follow-up, 11 of them received the schizophrenia diagnosis and 10 of them received the bipolar disorder diagnosis. They also were matched for sex, age, and educational level with other 21 subjects. So we collected this report at the first clinical interview, and then we wait to the last subject to finish the follow-up to start the analysis. And this first interview was actually already pretty revealing of this later diagnosis. So here you can see by those representative examples that schizophrenia group performed graphs with LSCs in the range of 4, 5, for example, very different from those ones that were experienced very similar symptoms, but actually received the bipolar disorder diagnosis after 6 months of follow-up or the matched controls. When we tried to see if what was the best predictor, the best thing to ask the patients to report to us and to represent as a graph, we saw that also in the sample, the dream report was the most informative report that you could ask, followed by the affective pictures stories. So we showed them some stories with negative or positive valence, and they had to create a story and report this story. Much more informative than the neutral image or reporting the previous day or the oldest memory that they could recall. Also, one thing that we did is that as you have a graph, you can actually see this topology on this original graph, but you can also compare this topology with some random graphs made with the same set of words. So we did this by shuffling 1,000 times this word order and creating 1,000 random graphs with the same words used for the original graph. And by doing that, we could see how much random like was this report, this original report. This is actually also inspired in psychopathological symptoms called word salad. So when the patient is actually severely impacted by the cognitive loss, it's common to communicate themselves with such a randomness way to report their memories that it looks like a word salad. So we did this model and we compared the original connectedness of this graph with this random distribution connectedness. And as you can see here on this representative examples is that for the schizophrenia group, you have the original LSC very similar to the mean of their random distribution, very different from what occurs for bipolar disorder and control groups. And when we define as a random-like zone between two standard deviations from this mean, we can see that 64% of those individuals that received 6 months later the diagnosis of schizophrenia were already talking, performing random-like graphs at the first clinical interview, much higher than the 5% in the control group. So we combined all those connectedness attributes in a multilinear correlation and tried to predict, tried to see if it was associated with the negative symptoms. And we saw actually such a strong correlation that with an R-square of 0.88, that were also almost like it was another psychiatrist evaluating the same subjects. So we defined this this metric as a disorganization index, combining, extracting the collinearity between those attributes and combining the most relevant attributes And using only this number of disorganization index, we could predict those ones that received 6 months later the diagnosis of schizophrenia with more than 90% accuracy. But also when we split up the groups between those ones that had mild and severe cognitive symptoms or negative symptomatology, we could distinguish them, both groups, with 100% accuracy using graph only this disorganization index. So the next question was, by theory, as we are only repeating the same words, by theory, it wouldn't matter the language that the subjects were talking. So we made some translations to study this, and we saw that it persisted, very informative. But in this paper, we had the opportunity to assess this data set collected in England, so in the University of Nottingham. So for native English speakers, the same results were found. But more than that, this group had applied this scale, the thought language index, that uses some reports from images that are neutral images showed to the subject. And they had this evaluation, the raters evaluations. They had also the cognitive performance assessing working memory and speed of cognitive processing. They had also scales applied for measure the autonomy of those patients, and also some fMRI data trying to see the neural disconnectivity of this group. They had a functional measurement, called the variance degree centrality of the core hubs from the full mode network. So they performed 10 minutes of rest, and they calculated how connected was this the full mode network. And they also had this purification index that it's a more anatomical measurements. And they had, as I told you, the report from 3 pictures. And we added the graph analysis for this data set. They already found some correlations between the behavioral tasks, but none of those behavioral measures were correlated with the neural data. So by adding the graph analysis, we could see correlations with the psychometric, the cognitive performance, and the autonomy from the patients, and also with the neural disconnectivity. So our most recent paper on this topic is this one, also a collaboration with the University of Glasgow. And on this data, they had even a previous stage of psychosis. So before the first onset of psychosis, before the first psychotic break, the subjects experience some prodrome, so some mild symptoms of psychosis. And this is a very strategic period on their lives, because they didn't have experienced the loss of cognition yet, and have started some and have kept some social bounds. So what they had collected some interviews, and also the thought language index scales from those patients in the first episode, psychosis, and also during the clinical high risk and the prodromal phase. And what we can see is that the LSD was actually also lower for the first episode patients compared to the healthy controls and to the prodromal patients. But when you distinguish between those that prodromal phase that transited to psychosis and those that didn't, you can find difference and lower connectedness on those that transited to psychosis. So the next step was, as you can see, in a severe stage as schizophrenia, we have this cognitive decline linked to the low connectedness on graph analysis. Maybe during cognitive development on children, we could find this cognitive development associated with an increase on connectedness. So we applied the same protocol of reporting short-term memories, reporting stories based on affective pictures for children from 6 to 8 years old in public schools in Brazil. And we correlated the graph analysis with math and reading performance, and also IQ performance and theory of mind. That is this ability to understand that others' mind is different from ours. So we are not born with these characteristics. Actually, this develops in a very wide range. Some adults are not actually able to understand empathy, for example, and that explains the lack of theory of mind. And this can be studied by those cartoons that actually have the sense in these cartoons that to give the correct answer, the child has to understand that the character doesn't know what he knows by the history to give the correct answer. So in general lines, what we found was that those kids that had low performance on IQ, theory of mind, and reading tasks were actually those one performing graphs that had lower connectedness and more frequently repeated the same word association. So we found that connectedness was associated with IQ and theory of mind. And all those behavioral measures were actually predictive of reading performance in the end of the year. So we could see that maybe IQ or even theory of mind is mediating this relationship between connectedness and reading. But actually, when we adjusted this correlation by IQ, the correlation between connectedness and reading remained significant, but not the theory of mind with reading. As well, when we adjusted for theory of mind, the correlation between connectedness and reading remained significant. And it remained significant, the correlations adjusted by connectedness, showing that connectedness seems to be independently associated with reading, but only for short-term memories as well. So we tried to get more further in this question of cognitive basis of this ability to talk, performing well-connected narrative, and we applied the same protocol and also some tests on short-term memory and working memory. But we use it here, a paradigm that actually tried to see not only the verbal memory, but also visual spatial memory. And as you can see by those representatives, the verbal domain was correlated with the graph connectedness. So this example here shows a child that had low performance on short-term memory, verbal memory, and also reported a story that it was not well connected. And one thing that shows here that it's actually important to see is that only for the verbal domain we could see this correlation, but not for the visual spatial domain. So what we conclude by that is that probably is the ability to have a lot of verbal information before, while planning the narrative, that it's important to perform a graph with a high connectedness between all the words that are actually used to report this story. So the next question was, what are the major factors that are important for this developmental curve? Is that age and nature is actually able to teach a child how to speak in a well-connected manner? Or would that ability require some formal education? And actually, it's a need for tutoring how to speak that would be actually relevant for that. To understand better this developmental curve, we studied a larger sample on 200 subjects with a very diverse age and educational level range. So we studied individuals with 2 years old until 16 years old, and with no education at all, and 20 years formal education. What we saw was that for those that didn't show it psychotic symptoms, so typical subjects, the child came from this pattern of low connected graphs with a very frequent repetition of the same word association to pattern with more adult-like that were very highly connected and with small repetitions. So here you can see that though children and also adults with psychosis talk it with a fewer lexical diversity, a measure here by the notes, with a larger, more frequently short-range recurrence, with a smaller connectedness or long-range recurrence, and smaller graphs. When we studied the correlations by education and by age, what we saw was that for psychosis, none of those factors matters, actually. They were not associated with the graph attributes. But for the typical sample, what we saw was that age correlated with some attributes, but when we adjusted for educational level, it didn't remain significant. But when we studied the correlations for educational level, it was significant, even when we adjusted for age, showing that educational level is the most important factor to explain this development. So here we plotted a developmental curve, designing that the first years of education would be the faster development, and then it would stabilize somehow and acquire the adult pattern. So we made this model, and as you can see, the psychotic sample didn't fit for the model, but the typical sample did. And as you can see here, for the asymptotical value, the characteristic time is just the first year of education. So at the first year of education, a child already starts to talk with the lexical diversity expected for an adult. And they stop at the short range recurrence, the repetition of the same word association. But for measure attributes such as connectedness or the long range recurrence, it required at least 13 years of education to reach this asymptotical value, and the 11 years of education to reach out this and to stabilize this graph size, showing that this maturation occurs in different periods of education. So for short range recurrence and lexical diversity, first year of education in elementary school, it's already enough. But for the development of graph size and connectedness, it requires a high school level. So if it was reading or formal education that was important to develop this ability, it was expected that preschoolers were actually more similar to illiterate adults than the literate adults, and that's what we found in an independent sample. So we collected the same protocol with an independent sample of illiterate adults, and what we found is that their connectedness were different from the literate adults, but similar to preschoolers. And here it's performing the random graph analysis, and as you can see, you can see that those ones that had fair time of education, they occupy this wide range of similarity to random graphs, different from those that had more than 12 years of education. So also this developmental curve, it's important to see at the individual perspective, but it's actually pretty interesting to see in the development of literature and seeing the similarities between the individual development and this historical development. So what we did, we applied the same technique to see the development of those attributes on 5,000 years of literature. We studied from books from Syro-Mesopotamia and Sumeria, Egypt, Hinduist, Judo-Christian, Greco-Roman, Persian, medieval, modern, and contemporary literature. It's spanning more than 5,000 years and more than 700 books on this. And we did the same analysis of using graph theory. And what we saw was that just like a child learning to read, as literature developed in the same direction. So it increases the lexical diversity, decreases the short-range recurrence, increases the long-range recurrence and the graph size. Here, I nested the analysis, but see that during this historical time here in between the less than 500 minus 500 from price birth, you can see that break and that subtle differentiation of this pattern of talking. So it seems that before that period that we actually known as actual age, the books had much smaller connectedness compared to the books after this period. So here, as you can see, it's very similar in the same direction as child development. So, but the periods of development are actually different. So nodes and graph size are still developing and will stabilize just in the future. But actually, the long range and the short range recurrence are already stable. And it stabilizes at the end of the Bronze Age and during this transition to the actual age. So to summarize all these data sets, we have here that just paying attention that this axis here, it's in the wrong direction, just for the datics, okay? So the lower range is here and the higher range is here. So if we plot this data only based on the long-range recurrence and the short-range recurrence, we can see that preschoolers starts here with a smaller long-range, and actually a frequent short-range recurrence. And as they learn how to read and educate themselves as children or as adults, or through history and without psychotic symptoms, they reach out this level of literate adults that seems to be pushed by the post-actual texts, very different from oral tradition. So here we analyzed some Amerindian adult speeches that are actually pretty complex in the semantic sense, but the culture of the oral tradition, they tend to use more mnemonical aspects and short-range recurrence, and not the long-range recurrence that it's actually could develop it through the books. So in theory, we are now pursuing this theory that literate education pushes this mental organization in the sense to decrease the short-range recurrence while increase the long-range recurrence in a very different pathway from the oral educational pathway. So we know that this method is a low cost and feasible, but it needs to be tested in a much larger population, not only in the pathological point of view, but also in the typical development, and should be tested in different languages, cultures, and socioeconomic status. In the sense, we are developing a series of applications for smartphones, and we hope that in the future we could collect the data in a different settings in a remote way. So that would make it possible to the mental health professional not only to use their sensibility to listen to their patients, but actually to see some quantitative analysis and to see how connected is this narrative. And I want to thank all my collaborators, and I'm here to answer your questions. Thank you.
Thank you, Natalia, for your really interesting, really excellent talk. So until we have questions from the audience, I will start asking one myself. So how far do you think we are of having some of these tools applied in the clinics? And what do you think is the main obstacle? Why didn't this happen yet? Or perhaps it happened and I'm not aware of it.
What? I didn't understand, sorry.
So maybe I can get closer. So I was asking, what do you think is the main obstacle for this to be applied in the clinics? And if it hasn't been applied yet, maybe it has, I don't know.
The main obstacle to applying natural language processing in this clinical settings, I think it's the education for technology, actually. It's the interdisciplinary conversation between different fields. But actually, since 2 or 3 years ago, almost all the symposiums on mental health societies, they are actually they have at least one event on computational psychiatry. So I think that this is going to change in a few years. The most important obstacle I see here is the translation of the technology for real life. And I don't know if it's only for the education for the mental health professionals, but actually some economical barriers to science, things that we sometimes develop in academia are not yet a product to have this marketing. And actually talking like a psychiatrist, I can tell you that this marketing is very important to reach out these professionals. Unfortunately, it would be better that people use this science and read the papers, but actually it's not what we see. I don't know.
Right, and I also have another question. So most of your results are based on NLP applied to transcripts of interviews and reports produced by patients. But what do you think? Do you think you're missing out something important by discarding the acoustic signals? Perhaps you have,
Yes.
you have spoken with lots of schizophrenic patients, and perhaps you have developed some kind of intuition of what you are missing out.
Yes, sure. Excellent question. And there is a lot of signal in acoustics as well. There are other groups that are actually working on this. And there is a lot of information, for example, in the amount of pauses. So in this fragmented speech, they do perform a lot of pauses during their narratives. So they're talking and they stop talking and then they continue talking. And there's also the time of the pauses are actually also pretty revealing of those symptoms. So I think also something in the pitch and the variation of the tones of the modulation on the sound must reveal something. But it should be, I think that the best way to pursue this question is to analyze this in contrast with other pathologies as well. So there is a lot of similarities on this monotonous way of talking with depression, for example. So some patients with depression, they also do not modulate their voices very well. In contrast with bipolar disorders in maniac phase, that they tend to use a lot of variation. But yes, we can.
So maybe as a first approximation, you could introduce in the graph analysis some kind of token for a silence and see. Of course, we have silences in natural speech. Use them to indicate the end of a sentence and so on. But then again, perhaps you have the silence where there shouldn't be. So maybe that's another, so they kind of mix both modalities, so to say.
Yes.
So we have a question by Mauro. Will these techniques be used to track the response of patients to different cognitive therapies?
Yes, this is also a very interesting question. And actually, I couldn't yet have a longitudinal data to compare different therapies with those patients. As a clinician, I have to say that those cognitive symptoms are pretty stable. So if we see this association with the social cognition, I would say that this kind of analysis is more related to, it's more stable in time and not actually well targeted by the actual treatments. So psychopharmacology are actually very effective for the positive symptoms, for hallucinations and delusions, but they're not effective to increase or mitigate the cognitive loss. And actually, the field is moving for looking at other strategies. So behavioral therapy and psychoeducation and actually rehabilitation in social events or things like that, more linked to psychotherapy than psychopharmacology, are actually more efficient for this cognitive symptoms. Would be very nice to see it. Yes, great question.
Excellent. Well, I don't know if we have more questions. I think we don't. So I'd like to thank you again, Natalia, for taking your time and also traveling to your sister place to get better internet. So thanks a lot for that, and hope to see you soon when this is over. Yeah.
Yes,
Bye.
thank you. Thank you very much.
Bye.
Bye.
Ok, bueno, llegamos al final de la escuela, así que no tengo mucho tiempo para agradecer porque me tengo que ir a dar 2 horas de clase sobre dinámica del cuerpo rígido. No importa qué tan sofisticada se pueda poner la cosa con autoencoders y GANs y todo demás, nada, cuerpo rígido es el cuerpo rígido y hay que resolver las ecuaciones de Newton, eso es lo que me va a tocar hacer. Así que quiero agradecer por último, de vuelta, ya lo hice, pero lo quiero hacer una vez más a todos los oradores, a todos los oradores que dieron cursos y también charlas. También quiero agradecerles a ustedes por haber estado durante toda la escuela. Sé que hubo alrededor de 50 de ustedes que estuvieron absolutamente en todas las charlas. A algunos les habrá interesado más, otros les habrá interesado menos. La verdad que se agradece un montón que hayan estado presentes siempre porque es un poco lo que es básicamente lo que hace que exista una escuela y no seamos 2 o 3 personas hablando entre nosotros sobre Machine Learning. O sea, básicamente son ustedes. Y también, por supuesto, a los que presentaron pósters, charlas. Yo no pude ir a todas, lamentablemente, pero sé que estuvieron ahí firmes. Y la verdad que eso también hace que, a pesar de todo lo difícil que es, hacer un evento virtual, el hecho de que hayan presentado pósters hace que se parezca un poco más de lo que hubiese sido una escuela de todas formas, así que les quiero agradecer por eso. Quiero agradecer también, por supuesto, al Departamento de Física, a Hernán Greco, el director, y todas las autoridades que nos dieron una mano enorme para la organización de la escuela desde el principio hasta el final. Agradecer a Liz, por supuesto, Liz Tuz, que estuvo siempre en absolutamente todas las charlas para streamear y para grabar y se encargó de todo para que no lo tenga que hacer yo, que me hubiese vuelto loco. En cambio, él decidió volverse loca a ella para que no tenga que pasar a mí. Quiero agradecer a Hernán Bocacho también, que ayudó un montón con la organización de la página web, que después la cambiamos, pero estuvo ahí desde el principio dando una mano para diagramar todo. Y también quiero agradecer a Fundación. Fundación es la Fundación Ciencias Exactas y Naturales, y a la UBA, con el programa de reuniones científicas, quienes financiaron lo que iban a ser los pasajes de algunos de los oradores y también el café y todas las cosas que no pudimos gastar, que terminamos en una escuela virtual, pero bueno, las pudimos utilizar para el diseño web y tenemos una página web bonita gracias a la contribución monetaria de ellos. Así que eso es todo, esta es la escuela, terminamos. Vamos a seguir por Slack, en el sentido de que yo les voy a pasar por Slack y por mail, pero espero poder hacerlo sobre todo por Slack, porque en la lista de mails hay muchas personas que sé que después nos siguieron con la escuela, así que sería un poco importunarlos, pero si conocen a personas que no estén en Slack, díganle que se conecten. Voy a intentar hacerlo únicamente por Slack, si no se puede, lo haré por mail también, pasarles lo que sería la evaluación. La evaluación va a ser un multiple choice súper sencillo. No vamos a preguntar nada sobre las explicaciones, sino para hacer el ABC de Machine Learning, o sea, muy básico, simplemente porque la escuela para que dé un punto de doctorado tiene que haber una evaluación, si no es imposible que dé puntos de doctorado. Entonces la evaluación va a ser sencilla, digamos, yo les voy a pasar un link a un multiple choice la semana que viene y van a tener el resto de la semana, probablemente casi toda la semana para completarlo. Nada, va a ser sencillo, pero bueno, va a evaluar un poco también para que ustedes sepan ¿no? que también agarraron los conceptos básicos de Machine Learning. Va a ser eso, básicamente, la evaluación. Vamos a dar certificados de aprobación. Igual pueden tramitar también, después les voy a mandar información cómo tramitar el punto de doctorado. Y de participación, si no quieren hacer la evaluación, aunque yo les sugiero que la hagan, porque nada, va a ser una evaluación que es útil para ustedes también. En la página web de la escuela ya hay arriba a la derecha 2 botones, uno con el que dice slides y uno que dice videos. En slides van a ir apareciendo todos las diapositivas de los oradores a medida que me la vayan pasando, ya está la mayoría, las vamos a ir completando, y el botón de videos es un link a la lista de reproducción de todos los videos que fueron grabados de la escuela, que creo que fueron absolutamente todos grabados. Así que sin más, vamos a cerrar acá, la seguimos por Slack, y muchas gracias de vuelta para todos.
Muchas gracias.